My Health Matters is a flagship initiative of Global Health and Community Services, Inc. This monthly one-hour forum aims to educate and inspire communities across the globe. My Health Matters provides culturally relevant health information, resources and tools to get the best quality health care, access to some of the top health experts. Each episode will highlight the healthcare issues that disproportionately affect many communities, while also providing action steps to help us heal. My Health Matters.
Good afternoon. I am Kitty London, your host of My Health Matters television program. Today's program is being recorded. This television program is brought to you by Global Health and Community Service Incorporated and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. Our platinum sponsor is the Quantum Foundation of West Palm Beach, Florida. We would also like to recognize our other sponsors, the TED Center, Healthier Boynton Beach, Truist, Nonprofits First, Epsilon Gamma Omega, chapter of Alpha Kappa Alpha Sorority Inc. of Huntsville, Alabama, and Alpha Alpha Upsilon Omega, chapter of Alpha Kappa Alpha Sorority Incorporated of Wellington, Florida. We would like to extend a special thank you to our production team, C. Ron Allen and Nelonsky Noel of KOP Mentoring Group. That's it, and enjoy the show. Good afternoon, everyone. I'm Kitty London, your host for My Health Matters. I'm so excited to meet you all today, and we can get into the discussion that really matters for everyone, especially me, because I also have the sickle cell trait. Today, we are going to discuss sickle cell disease trait for youth and adults. I found out at the tender age of 18, being a single mom, that I had the sickle cell trait. I was scared. I didn't know what to do, and I was scared about the outcome. Thankfully, my son did not have either the disease or the trait, but I learned a lot, and I learned how many people it affects in our own neighborhoods and our families. So before we get into the show, I want to welcome you all. Get ready to be entertained, engaged, but we have
Good afternoon. Chances are you probably know someone who has or is impacted by sickle cell disease. Did you know that 1 in 13 African Americans has the sickle cell trait? On behalf of Global Health and Community Service, Inc., we welcome you and we thank you for joining us today as we take this opportunity to raise awareness about this devastating disease, elevate voices in the community to share what it's like to live with the disease, and most importantly, highlight potential treatments. So thank you for joining us. Sit back, relax, and enjoy their webinar.
Good afternoon. On behalf of our Grand Bosselist, Brother Ricky Lewis, our 7th District Representative, Brother Reginald Harris, and all the brothers in the Florida statewide organization. My name is Darren Toston. I am the 7th District's Florida statewide organization state representative, and I want to welcome everyone to today's discussion on sickle cell disease and trait. I would like to thank our speakers this afternoon for their participation in today's program and bringing this information to the public. I would like to thank our partners, Global Health and Community Services Incorporated, and all our sponsors for today's program. I also want to thank the Florida Statewide Organization's Medical and Health Initiatives Committee for working with Global Health to bring this program to our viewers today. Sickle cell trait is an inherited blood disease that affects African Americans at a disproportionate rate. Our speakers today share a vast knowledge on the topic, and we hope that today's program will be informative and answer any questions that you might have pertaining to sickle cell disease. Again, thank you for joining us today.
Hey, this is Kitty London, your host for My Health Matters. My health matters, but so does yours. I just want to make sure that you are aware that we have an amazing lineup still coming your way before the end of the year. And these shows are brought to you by the Global Health and Community Service Incorporated and also the Quantum Foundation. Also in November, when the holidays start and we want to eat everything in sight, well, at least I do, we're going to talk about diabetes, nutrition, and also the treatment. And that is going to be on November 5th, right here at noon. We want to make sure those numbers stay right so we can be around for a long, long time. Then in December, I want to make sure all my couples check in because we're going to talk about something that a lot of people may not want to talk about, and that's ED, and that stands for erectile dysfunction. And that happens on December 3rd. So when you think the thrill is gone, it may not necessarily mean that. We're going to have physicians that are going to talk us through this. So if you want to see all of these shows and any shows that we've done in the past, please make sure you check out KOP Mentoring Network on Facebook and also KOP Mentoring Network on YouTube. We cannot wait to see you because remember, my health matters, but so does yours. See you soon. Bye.
Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Thank you for that wonderful commercial. So now I'm going to read off our bios for our wonderful panelists today. First, we have Dr. Michael DeBon. Dr. Michael DeBon is a professor of pediatrics and medicine of Vanderbilt University School of Medicine. He received his Bachelor's of Science degree at the historic Howard University and a Master's of Science and medical degrees at Stanford University. He is our medical expert today with more than 25 years of experience in clinical research on sickle cell disease. Welcome, Dr. DeBon. Also, we have the Honorable Shalonda Warren. The Honorable Shalonda Warren is a West Palm Beach City Commissioner and a Chief Executive Officer of the Sickle Cell Foundation of Palm Beach County, Florida, and the Treasure Coast. Ms. Warren also manages a budget in excess of $1 million and implements long-term strategic goals in the organization's 5 county service areas. She is here to talk about the services of the Sickle Cell Foundation. Welcome, the Honorable Commissioner Warren. Last but not least, we have Reverend Jimmy Williams III. Reverend Jimmy Williams III is a senior pastor of the St. James AME Church in Miami and a former 2-term Homestead City Councilman. He has worked with the Florida state officials to seek funding for sickle cell disease, resulting in $200,000 for this effort. Reverend Williams is a survivor of sickle cell disease and will share his journey with us. Welcome, Reverend Williams. Now we are ready for the show.
Red blood cells are like a disc, almost like a frisbee, if you will. And in sickle cell disease, what happens is the hemoglobin molecules inside that cell snap together like Legos. And when they do that, they can change the shape of that cell from a frisbee to a more sickle form, a banana shape or curved shape, which is what the disease gets its name from, of course.
Because the red blood cells are that crescent shape, they don't live as long and they don't carry oxygen very well.
A shortened red blood cell lifespan results in a cascade of events occurring in the body: chronic anemia, severe pain, strokes, fatigue, decreased lung function, kidney function, heart function, and ultimately for the adults, a decreased lifespan. In the last decade, there's been an explosion in the options to cure sickle cell disease. And the science is as elegant as it gets in human work. That you can take somebody's cell, fix that person's cell, put that cell back into that individual, and they're going to be cured of that disease. That is just a beautiful concept that we all dream about.
This is a completely new way of thinking about sickle cell, and engaging patients in these conversations is so important.
That discussion is not a 4-hour discussion. That discussion is over years because it's experimental therapy and the information is evolving.
There's a role for this expensive, more scientifically amazing curative type therapies. But also we must focus on eliminating the disease burden in a broader population.
Within the US, there's 100,000 people living with sickle cell disease. Globally, there are around 20 to 30 million people living with sickle cell disease.
Sickle cell disease has sub-Saharan Africa as its epicenter, as well as the Middle East, India, and countries around the Mediterranean because of the high density of malaria. Individuals who had sickle cell trait were protected from developing life-threatening malaria. And so, as a result of evolutionary pressure, these are the regions that have the highest density of sickle cell disease.
Wow, I was really getting into that. Thank you, Dr. Jabon. I'm going to start with you. How is everyone today?
Well,
all right. I want to thank each and every one of you for being here. Dr. Jabon, I believe in starting with the basics. Can you please tell us, one, what is sickle cell disease, and also what is sickle cell trait?
well, sickle cell disease is a constellation of, I'm going to use the term hemoglobinopathies that make up hemoglobin SS, SC, S beta thal 0, S beta thal plus. And sickle cell trait, by and large, is a non-disease state. So if you have sickle cell trait, we expect you to have a normal lifespan. Rarely will you have medical complications. They do occur, but they're rare. Whereas sickle cell disease is a disease that can be life-threatening if not identified and managed early in life.
Okay. And then we hear the terminology sickle cell anemia. Is that something different? And can you elaborate on that?
So briefly, sickle cell anemia is a subtype of sickle cell disease. And it's the type where you have two abnormal mutations. So you get one causes S in one gene, the other causes S in the other, and that's why you get SS versus SC, S beta thal 0, and other types of sickle cell disease. So sickle cell anemia is both a type of sickle cell disease and it's its own disease in itself, just like SC and so forth. Sickle cell disease is the umbrella of all the types of sickle cell disease. Sickle cell trait is not part of sickle cell disease. It's not a disease in and of itself.
Okay. Now, is there any cure for any of this that we're talking about? The trait, anemia, sickle cell disease?
There's no reason to have a trait when it's not a disease. It doesn't result in a disease-like outcome, except in extreme circumstances, such as football practice in the summer in Florida. And in fact, this is the reason that the NCAA has these waivers for football players that they have to identify themselves as having sickle cell trait. So there's no reason for a cure for sickle cell trait. For sickle cell disease, there's a range of cures, some of which are experimental, and most individuals do not. Less than 2% of the individuals with sickle cell disease in the United States are offered and receive and accept a curative therapy.
Okay. Now, I just want to talk a little bit, just a little bit more about the trait, because I know so many more people seem to have the trait. I don't know if you have the statistics as far as one out of every. I used to hear 10 sometimes. I don't know if that has changed. And definitely, Commissioner Warren, I'm going to go to you with that question as well, because you do handle many people that have it. But, Doctor, you said people, football players, for example, is it because of the extremities that they go through when it comes to sports? Why would they need to give them that information?
Well, frankly, it's because of the medical legal system.
Okay.
Football players were doing off-season practice in extreme heat, unsupervised heat exhaustion, resulting in sudden death, similar to military recruits with sickle cell trait going through basic training. And so the end result of this was the NCAA decided, rather than to put themselves up for liability, that they would have a waiver explicitly to say, we know you have sickle cell trait, we're going to identify you as that, and you cannot sue us if you die during this process of early summer training, which is unsupervised.
Understood. Okay, because I have the trait, so that's why I'm like honing in, because I would hear people say, you just have the trait, but I know other people who've had the trait who still maybe saying they have joint issues or joint pain. Can you talk about that? And also, what for people who do have sickle cell, what do they go through? What are the medical issues that someone faces that has sickle cell disease?
All right, so there's two questions. I'll answer the
Yes.
first question
Mhm.
first about sickle cell trait. Generally, sickle cell trait, individuals with sickle cell trait live a long life expectancy that you would expect for individuals without sickle cell trait who are African American or of African descent. There are rare complications that do occur associated with the trait. Anytime an individual with sickle cell trait has blood in their urine or trauma to their eye, they should go to the doctor promptly. The blood in the urine could be associated with an extremely rare cancer. And then there are times when individuals with sickle cell trait will go to high altitudes and develop what we call a spleen infarction, where the spleen basically starts to die. But that's a very rare event. If you have 10,000 people with sickle cell trait, you would expect that to occur maybe once or twice out of 10,000. So it's extremely rare. In terms of sickle cell disease, as you just saw in the video, it's a range of complications affecting every organ in the body, including strokes. The hallmark of the disease is actually pain, which individuals with the disease describe as being severe, similar to glass traveling through their vessels. There's a range of problems with sickle cell, medical complications with the disease explicitly, but that's in brief. The hallmark is pain.
The pain. Okay. So speaking of that, what kind of medical advances in research have helped patients through this condition and live the best life that they can possibly live?
Well, there's been medical advances over the last 30 years. Initially, in the mid 80s, there was no treatment for sickle cell disease, and we found out early that with newborn screening supported by every state program in the United States, we can identify children with sickle cell disease at birth through the newborn screening program, and then they're seen by hematologists within the first 4 months of life. Subsequently, they're given penicillin, antibiotics, which is antibiotics plus vaccines. And then there's newer treatment with hydroxyurea. And so now we're seeing children with sickle cell disease expected to live to their 18th birthday. 99% of all children born in the United States will live to their 18th birthday. That was not the case 20 years ago. And I'm seeing children who are now participating in sports at a level that was unfathomable 20 years ago because of treatment such as hydroxyurea and newer treatments that are here. There is a cure for sickle cell disease, and there are multiple different ways to cure sickle cell disease, but I have to be brief about this. They are all, in my opinion, less than optimal, and we're still struggling with the best way to inform families about options for cure, and then what happens after cure. Particularly for young ladies, and most of the cures that are available, they will not be able to have children in the future. And they were trying to develop strategies to improve the outcome and decrease the late health effects of curative therapy.
Wow. Wow. You got me mind blown there because I thought I would never hear that. Okay. And one last question before we move on. Are there any diet restrictions or lifestyle restrictions or advice for people who live with sickle cell to help their condition out?
Well, I think the first is to be best informed of yourself, to know what stresses. There's clearly a mind-body interaction in terms of disease. I would also recommend strategies to eat healthy and exercise within limits, and then to de-stress activities in your life. Just the general health rules we all know and have a hard time practicing ourselves.
Amen. Thank you. I'll be back to you soon. All right, now I'm on to Commissioner Warren. Good afternoon. Tell us about the Sickle Cell Foundation of Palm Beach County and the Treasure Coast.
Thank you so much, Kitty. And thank you for inviting me to participate with these distinguished guests that you have. You have an amazing panel that you've put together. And the Sickle Cell Foundation of Palm Beach County and Treasure Coast has served the community for over 50 years. We've been in operation since 1971. We were incorporated in 1973. So we've worked for a very long time to be out in the community. We were actually our very first CEO was a young lady by the name of Eva W. Mack, who went on to become the first Black commissioner of the city of West Palm Beach, and then later became the first Black mayor of the city. So she was very engaged in the community, and she was actually the first health practitioner for Palm Beach County School District. So she was very active and engaged, and that was the foundation of the foundation. And we've been fortunate that since that time, we've continued to grow from Palm Beach County and serve throughout the Treasure Coast. I'd be happy throughout this conversation to tell you some more about the services and different things that we've provided, but that just lets you know just how long this agency has been in the community serving.
Well, we've sat together so many times, that was actually going to be the next question. We hear about the foundation, but can you tell us what services you offer there?
Sure. Thank you. Thank you very much, Kitty. Sometimes it changes because funding changes, and the resources that are available and allocated to agencies has really changed over the last 15 years. But at Cell Foundation, we work to provide advocacy. We provide education throughout the community. We go into schools, talk to people about educational sickling that Dr. Baum has mentioned. We've worked with our client case management. We provide genetic counseling. We provide services like referrals. We connect our clients. We provide
I think we're having some technical problems. We'll get her back on as soon as possible. Before I go to you, Reverend Jimmy, we have a question from the audience. Dr. DeBon, I think this may be towards you. It's from Avis Brown, and she's saying, what can be done to improve access and remove the barriers to a life-saving bone marrow transplant treatment for sickle cell population?
That's a complicated question. I will try to be
in the medical field, so it would be.
Yeah, I'll try to be brief.
Okay.
So the first point is that for individuals affected with sickle cell disease and their families, they should recognize that this is actually a marketplace. People don't talk about medicine in that capacity, but it truly is a commodity. And so part of the challenge when a family says, okay, I would like for my loved one to undergo a transplant is to identify the range of options and to be able to actually say, here's choice 1, 2, 3, 4, 5. What are the pros and cons for the 5 or the 4 different strategies? There are literally fundamentally 4 different ways to cure sickle cell disease in 2022. Wasn't the option 20 years ago. That's number one. Number two is you want to look at the experience of the center. Simply because you can say you can do transplant doesn't translate into the experience. There are some places that have better skill sets and a stronger track record. Number 3 is to work with your insurer. In most states now, Medicaid will approve a transplant. And so that would be for the state of Florida, just about every other state in the country. So it's a difficult path to navigate through without some advocate on your shoulder to help you direct yourself. And in some places, you might be close enough to a medical center that does transplant. But in all cases, I would say you would want to be a prudent shopper to find the best opportunity for curative therapy.
All right. Thank you. All right. Thank you for rejoining us, Commissioner Warren. I'm going to be back to you shortly. Reverend.
Yes.
Honorable Jimmy L. Williams III. I just like to say all of that. It sounds
Okay.
so. Thank you. Thank you.
You're mighty kind.
I know in your bio, it was labeled as a survivor, but I know you are clearly a warrior. So if you can please just, share with the audience your journey, with sickle cell and, how you found out you had it and your diagnosis and just your journey.
Sure. So let me thank you so much for inviting me on such a show as this, and to the other guest panelists. Very much appreciative. So my name is Jimmy Williams, and I was born in 1979, and both of my parents had sickle cell trait. Of course, they didn't know they had trait because they didn't know it existed within their context of their family line. Although I did have an aunt who had sickle cell and died very early, probably late 20s, early 30s. So with that being said, I'm 43, which means I have surpassed 19, 25, 35, 40, the expectancy that they give persons. And so I've never allowed the medical society, or even working with some of the pharmaceutical companies like Novartis and GBT, who Pfizer just acquired, with Oxbryta, and these are new gene therapies. These are therapies out there, and the other one is CRISPR. And so, but anyway, I think that my journey has been one such as a triumph, a going to the limit, pressing myself, not allowing society or the stigma to trap my being and my consciousness. And so what I've learned to do is be a powerful advocate, which has led me into being in politics for 8 years, which has led me pastoring over 20-something years in the AME church, and have sent me to Africa and West Africa. I often tell people, sickle cell to me is oxygen deprivation. And people don't die from sickle cell, they die from the complications, the organ failures, kidney infarcts, acute chest syndrome, VOC crises, which is pain. Pain does not kill, it's the organs that are damaged. And so my body is like, I'm 43. The hits I've taken, probably I'm like maybe 54, technically, if I had the proper blood count in terms of being a normal individual without the disease. So, and my other greatest pride and joy is my son, Jim the 4th, and he has the trait. And so he's my caretaker, he's 12, and then I have an older daughter. And so that has a huge impact on my journey and my education ability. So I've been really, really blessed to speak all over the world with this.
Great. Now you mentioned something key, because you went to those milestones of 1935, I think you said.
Well, yeah, go ahead.
Right. But how does that play on the mental? Because we have people maybe watching the show right now and they have it, right? So they're, I'm sure they're probably marking those calendars too, because statistics says this. And how can you basically give people advice on how to not think about that? Because that has to be hard on the mental.
Right. So, mental health is one of the biggest issues in the African American community as a whole. Secondarily, it affects sickle cell patients in terms of, you have patients who've never had a job. They've been on SSI all their life, only getting $795 a month, got to stay with parents, never advance off to college, never, all they know is in and out of the hospital. And some people can go in for 6-7 times a year, depending on how bad their sickle cell is. Sickle cell pain is very objective. And some of the stigma that's attached to that, when you go to hospitals, some of them call you, if you go to the same one, a frequent flyer, systemic, institutionalized, taught racism. in terms of the neglect and understanding of this disease. And so I say all of that because it's very vital that for those who have the disease, need to know that you are a thriver and not a survivor. I'm going to change it in my bio because I've evolved. And I think that has helped my mental capacity have something to live for. Don't let anything stop you. You can earn a degree. I have 3 degrees. And so I know what the struggle is, and to have pains and crises and being in class and not being able to do certain things. Don't allow the limitations to hold you back.
Right. Now, I was going to ask you too, in regards, because you sound like a person who, one, has, everything together mentally, right? Because I mean, not everyone has that. I mean, and unfortunately, because one, they may not have support,
Sure.
or just a lack of education, or just because people will listen to Google and say, I have a death sentence. Why should I live on?
Right.
How do you encourage people as far as, getting into these support groups to help them be more educated about their disease and also become advocates?
So what I tell sickle cell patients, and fail to mention, I do advise the Foundation for Sickle Cell Disease Research in Miami, in Hollywood, Dr. Lynetta Bronte Hall. So what I tell individuals are that when with this disease, you are the experts, not the doctors. You're the experts, and I know I may get some pushback, but I say that because articulating how you feel. I know the doc said pain, but we go through fatigue. We go through all sorts of different things, and I think you have to continue to push past that point where, yes, I have my up days and my bad days, but you'll never be able to tell the difference because I don't wear it on me. And so the last time I was in the hospital was over 5 years ago, but that's because I started taking these new therapies that are out there that is rarely talked about, and it should be in every medical news journal that there is. That there is more. There are 3 therapies beyond hydroxyurea. 1 out of 3 patients cannot take hydroxyurea. I'm one of them. And so you have different therapies out there that they need to become very knowledgeable so they can educate their doctors. Not all doctors who are hematologists, oncologists, deal with sickle cell disease. That's a misconception.
Great to know. And Dr. DeBon, we have a medical question, and I also want to kind of feedback off of what Reverend Jimmy said as well. You have all these therapies and these new medications. Let's face it, especially people in our community, we're scared of medications. We're scared of side effects. Sometimes we're even scared of doctors, right? So, but we want to choose to live. One advice for people who may be scared to try these new medications, that's one. And then we also have a question from Etta Carter saying, what are the guidelines for ER for sickle cell warriors?
Yeah, okay. So let's just face it. In the United States, healthcare is driven by the market. And I said it more. I'm going to say it more than once. So you get different levels of care based on your ability to pay. And so it's clear that one of the biggest risk factors for earlier death is, in fact, poverty and being on Medicaid continuously. And so when in most major cities in the United States, the majority of internists will not take a patient with Medicaid. And so the patients end up having to go to the emergency room to get episodic care. And we all know that episodic care is not the standard of care for any chronic disease, be it asthma, diabetes, sarcoidosis, lupus. Everybody knows you're going to get less than standard care in that setting. So that's number one. In terms of the care in the emergency room, there are standards in the emergency room. There are standards that all professionals who are board certified emergency room physicians are supposed to meet as quality improvement programs, but there's very little ways to enforce it. Ironically, the only way I have seen that this has been enforced has been with litigation. I've seen litigation change the way emergency rooms wait. There have been times with patients with sickle cell disease in extreme pain, the type of pain that you would expect with a femur fracture, are waiting in the emergency room for 8 hours to be seen because they're put off on the sideline and accused of not having severe sickle cell disease pain. So there has to be strategies that we use as a community to be advocates, both as an individual also using your state representatives, your elected officials, as well as the medical legal system to demand standard care. Because when patients receive less than standard care and there's harm to the patient, there's a litigation system that is set up to address this in a serious way. I wish I would like to be more optimistic and say, this is something that caring physicians would like to embrace, but I'm more realistic and say there has to be some pressure as a group to direct on the force of the healthcare system to give humane care to individuals with sickle cell disease in the emergency room. Gotcha. I can keep going, but I'll stop because
No, we're gonna have a break in another minute or two, and then we're gonna go back to Commissioner Warren because she's over there now. We're ready to hear from her. But Dr. Bond, as far as the medications, like I said, therapies, do you have any advice for people who are just like, I'm scared to take them?
So this is a matter of finding. If you go to a physician that doesn't know your name, doesn't know the name of your significant other, doesn't have a relationship with you as a provider, it's less about what medications are offered. They could offer you water. You're not going to trust them. Mm-hmm. So part of this is finding providers who are interested in you as an individual. And then from that interaction, you build trust. From that trust, then the conversations around treatments that have been approved and that have been demonstrated through rigorous work to improve the quality of lives and prevent complications in sickle cell disease, that conversation starts to occur. But again, it's very difficult if 60, 70% of the adults, which in most major cities, that's the case, have Medicaid, to find an individual who is willing to take on a Medicaid patient and then a patient with Medicaid insurance. And then even if they are not, even if they have private insurance, the number of adult providers who are knowledgeable about sickle cell disease, as was mentioned by the Reverend, is very low. I'm talking in major medical cities, metropolitan areas, 1, 2. Cities like Philadelphia, Chicago, there are medical centers, only 1 or 2 medical centers in those regions that actually will be willing to see an adult with sickle cell disease.
Wow, that is grim. All right, well, thank you for that information. So we need to pay the bills. We'll come back and then we'll start off with Commissioner Warren. So we'll get back into our conversation in regards to the Sickle Cell Foundation of Palm Beach County and the Treasure Coast. We'll be right back.
Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
All right, we're back. Okay, Commissioner Warren, I want to give you the opportunity to answer the second question again. And let me just remind you of what that was. Regards to services, can you tell us what the Sickle Cell Foundation of Palm Beach County and Treasure Coast provide for the community?
Thank you very much, Kitty. Well, first we provide advocacy. Advocacy is extremely important. We provide education services, outreach services. We provide mentorship. We provide services, where we actually go to the emergency room to advocate for some of our clients when there are situations, because we recognize that there's a tremendous need there. And it's amazing to realize that there's still such a disconnect, and that it is so important that we have between people with sickle cell and the medical community, so that we are in one accord as we have different conversations. So that is definitely something that we do. We provide genetic counseling. We provide focus groups for children with sickle cell. We also provide focus groups for families and caregivers of people that have sickle cell. And Reverend Williams said something that's very interesting. We also believe that the person with sickle cell is their primary caregiver, and it's important to equip them with as much information as possible because they have to be their biggest advocate. They have to know how to deal in society with having a blood-borne disease. So we work very hard to make sure that they have all of the tools necessary in order to live the happiest, healthiest life that they can. And we provide referral services to other agencies throughout the community that may be able to assist them in a greater capacity than that which we can at the foundation.
Okay. And also, Dr. Devon mentioned something very critical as far as insurance. Do you see for people that come to you, Commissioner Warren, that they seek financial assistance or information in regards to insurance? Is that something that you all are able to help, or you kind of can give people the avenues to go if they are in need of those services?
Well, the services we provide are totally free to everyone. We are funded through grants and through partnerships with different municipalities that subsidize the work that we do. And we connect our clients to different agencies that provide insurance to people that do have pre-existing diseases. That is something that we certainly do, but it is certainly a challenge to find people to find that the coverages that they need for the medical attention that they require.
And you mentioned something also very key. You said genetic testing. Earlier in the show, I mentioned that I had the sickle cell trait. I didn't know I had the sickle cell trait until I was 18 and, was pregnant. So I'm not going to say at that time it was too late, but, I started thinking in the, back of my mind, I'm like, well, this is why they call planned pregnancy, because had I maybe done it the right way or what my mom wanted me to do, right, is you get married and then you find out. Back in the day, I don't know if they used to do this, but the man was genetically tested and you were, so you all kind of knew what was going on. So now, we know all this information is out there. Do you recommend that people, even if, they're not carrying at that time, but let's just say, they want a partner and let's say, let's go get genetically tested together. Is that something that you see people even do?
Genetic testing is something that's actually done at birth, and particularly in the state of Florida. However, we do have people that come in that when there's a young lady that presents and she's identified that she has sickle cell trait, they will refer the partner to us for them to be tested to see whether or not they have the trait as well, so that they can receive additional information.
And that was key because I was born in Boston. So maybe, and in Florida, we have a lot of people that are not from here. So that's why I'm just wondering, how can we be, I guess, maybe proactive about it?
We actually test genetically for during newborn screening in all 50 states, but we do have a lot of people that come from other countries into the United States that may not have had genetic testing at birth. And that is also something that we see a lot of clients, particularly here in Florida. Florida is one of the highest states in the nation with occurrences of sickle cell disease. And we have a lot of people from the Caribbean, from Haiti. And we have a lot of people that have come in actually after the earthquakes that occurred in Haiti that are undocumented in this wonderful area. So there are a lot of different issues that we face here in Florida that are unique to us. But we at the Sickle Cell Foundation of Palm Beach County and Treasure Coast do provide testing upon request when there are people that present and are interested or curious to know whether or not they have the disease or the trait.
So Kitty, can I just jump in here real quickly?
Yes.
What you're describing is an absence of healthcare for people of color in the United States.
Okay.
Frankly, when you are born in Saudi Arabia, you are tested for sickle cell trait before you get married. It's standard. It's also standard in Italy to be tested for thalassemia. For Jews, it's standard for them to be tested, particularly Jews of a particular region, to be tested for Tay-Sachs disease. The fact is that in medical schools across the country, they're not teaching primary care providers to screen African Americans as part of their health care anticipatory guidance.
Okay. I knew I was going to something.
Yeah. So this is a gap. Okay. They don't believe that we should be entitled to know our sickle cell trait status before we leave pediatrics. So most teenagers are not educated about their status before they leave. It's only the educated physician, the enlightened pediatricians or family practice providers or internists that will say, are you thinking about having children? Let me tell you if you have sickle cell trait, C trait, thalassemia trait, all of which could end up in you having a child with sickle cell disease. Not putting any judgment on whether you want to have a child or not, just informing you. That should be standard. That should be the standard curriculum in every medical school and part of examinations for board certification in all subspecialties. It is not.
Go ahead, Reverend.
Dr. Max, your question. What state are you in?
I'm in Tennessee, but I work, but I'm familiar with the other states as well.
Okay, let me help because this is a lot of panels I do sit on with this misconception. So New York is like the number one, and Florida is number two now. It used to be number one, but 2/3, there are 10,000 patients, let's say in Florida. 2/3 of them live in South Florida. That means Palm Beach County, Broward, and Miami-Dade has 2/3 of the population for persons with sickle cell in the state of Florida. Now, when you have rural areas that we have in Florida, you're going to have some dry areas, some dry spot. A place called Port St. Joe, where I was living there for 2 years. Had a crisis, had to go to Panama City, 40 minutes away. So when you talk about metropolitan areas, and especially in Florida, you're going to have a lot of dry spots that they have no idea. And if you're on opioids to help, with the pain, you're going to have pharmacists that won't fill your prescription. I mean, there are so many barriers beyond just the medical aspect of it, of biasness in the community, but being believable, because pain is subjective, and if they don't feel like treating you, they don't. And some hospitals and places, IV, they put you on a pump for two days and give you oral medication and get you out the door. That's not true comprehensive health. And I think what persons miss on these kind of panels is the patient is the expert. The science is great to know, but when we use words like vagus necrosis, you want to be able to tell a layman person, what does that mean? That means you just had a sickle cell crisis. That's what it means. So, for VOCs or vagus necrosis with the hips and bones. So, but the patient has to take control of that. And you don't have a lot of hematologists, especially in Louisiana. Not one out of 300 that was asked, did they have any sickle cell patients? Not one out of 300 hematologists in Louisiana. That's crazy. When you have hemophilia, there are 30,000 hemophiliacs in this country. There are 330 centers. But that's a minority white disease, so a complication in their bloodstream. But hey, we don't. We probably have 1 or 2, 3 or 4 in Florida, if that.
You're right. Thank you for that information. And we have 2 questions for the doctor, but I just want to make sure that I cover this also with Commissioner Warren, because I know a lot of work you do in the community. Can you tell us really quick how you have fundraisers so people in the community can assist with that as well, and educate us really quick on Redteenth? I know that's a terminology a lot of people are not familiar with, but once they find out what it is, I'm sure they'll start being familiar with it.
Thank you, Kitty. We have several fundraisers throughout the year because we know that sickle cell is grossly underfunded in comparison to other diseases in this country. And we know that there's a disproportionate amount of people with sickle cell in comparison to the dollars that are received for care. So one of the events that we have is called the Eva Mack reception, which is named after our founder. We have that annually, and we have it typically at on the anniversary of our incorporation. And Redteenth is also Juneteenth. So it's a combination of World Sickle Cell Day and Juneteenth recognition. And we have a huge event where we bring people out and raise awareness and talk to people about what sickle cell is. And we make it as fun as possible. We bring in different providers. We bring in people like GBT and the different pharmaceutical companies. We bring in even sister agencies that provide sickle cell services. We want to make sure that we're a conduit for everyone to have access to information. And we have it fun. It was hosted by a lovely young lady by the name of Kitty London. Yes, you. As one of our hosts, because we wanted to make sure that it was engaging and that people would come in and that they were receptive and open to receive the information. So that is certainly a celebration that we've had. And what most people don't know is that World Sickle Cell Day has been recognized on Juneteenth for many, many years. And it has been 13 years approximately that we've been celebrating Juneteenth and recognizing World Sickle Cell Day. And so we look forward to people coming out next year for Juneteenth. Upcoming, we have a walk to raise awareness for sickle cell. It will be in December. So please save the date for December 10th to come to West Palm Beach and Riviera Beach. We're going to go out in our red shirts and make sure that everyone knows that sickle cell disease is still here. There is not a universal, unilateral, clear cure that has occurred for sickle cell disease. It is something that does still typically we consider cradle to the grave. The people that are born with it have sickle cell disease for the duration of their life, unless they're one of the small percentage of people that have the opportunity to have sickle cell cured. But we can talk so much more. And I would encourage people to go to the website to see all of the different things that are available and the ways that we're communicating what's happening in sickle cell at www.sicklecellpbc.org to find out more information about the upcoming events.
And maybe either you or the Reverend can answer this question, because I know you are in Palm Beach County. Thankfully, My Health Matters has a very diverse audience. So we may have someone looking in Texas or, I don't know, California, Ukraine. I mean, it is global, right? But if someone wants to get involved, should every local municipality have their own sickle cell foundation organization, or is it just selected?
Let me take the political answer, because I don't want Baltimore's where the National Sickle Cell Association is. They used to have what they call HRSA grant that deals with new birth screening. But let's just say they've had to pursue other avenues. But and they have to qualify you. So where it was when mom and pops had sickle cell when I was in advocacy group, helped pay for my prescription when I was in college, it's shrinking because of what the qualifications are to meet those standards. And then now any of these CBOs, community-based organizations, could go after the same funding. But there are millions of dollars out there through pharmaceutical companies. I sit on the board, GBT Foundation. We just gave out over maybe $500,000 to CBOs and academia centers. So the money's out there. You just got to go and get it. And they come for all these kind of other places, Bluebird Bio. I mean, I keep going down the list, Novartis, Pfizer now. So I've been traveling and talking on these platforms and advocacy for a long time. So yeah, it's important to have that knowledge when you go places.
Thank you. Okay, so we have two questions for the doctor, and then we have one for you, Commissioner Warren. But let me get the medical questions out the way first, because I know sometimes they can be a little lengthy, and it's fine because we need to know this information. So Dr. Devon, we have a question from, and hopefully I don't mess up your name, I do apologize, Habiba Haq, MLT from UAE, ask how you diagnose it from pathology or a laboratory point of view.
Yes. So the diagnosis is typically with, depending on the country that you live in, but I would expect in the UAE that they would have HPLC machines to make the diagnosis. It's a blood test, and then it takes probably 24 hours to get the blood test result back, although you may not get the report back for 5 to 7 days. But it's a blood test that's obtained routinely in any primary care provider's office.
All right, thank you. And then we have a question from Rita Williams. She says, can someone speak on crucial need for a seamless transition from pediatric to adult hematologist?
Yeah. So that's like an access to care question, right? Most physicians or offices or providers, the transition period from adolescent to adult is so difficult. Some people still in their 20s see their pediatric doctors because there's nobody to take them on. And so it's very difficult, and depending on what state you're in as well, but it's very difficult for that transition because there is nobody on the other end that's a connector. And they may not have sickle cell, wonderful organization like Palm Beach to the Treasure Coast to be able to rely on.
Thank you for answering that question. So we talked about the foundations. Commissioner Warren, if you can answer this question, maybe people want to start their own foundation. How does one set up a sickle cell foundation in their community? That was a question.
Thank you. And Reverend Williams also mentioned this too about SCDAA, which is Sickle Cell Disease Association of America, and that there are some very stringent guidelines in order to become a sister agency. But I want to say that although it is a process to become a nonprofit, I think that is very worthy. It's something that's very important, and people should always follow their passions. And one of the things that people can do is really to volunteer with other agencies or volunteer with other nonprofits learn the processes that are necessary in order to develop their policies and their bylaws, but to work with organizations, because those MOUs and those partnerships are going to be critical when they go to apply for different funding. They would need to establish their fictitious name and come up with their tax ID, and then to bring together a board of qualified individuals and establish their bylaws. But I think the most important part is to just be active, be engaged, be in the community, let people know who you are, let people know your passion and what's driving you. And those things are going to be fundamental in how you begin to establish and build a rapport and relationships within the community. And then different states have different guidelines, and different counties within those states have different guidelines as well, because they'll also need to be certified by the state to show that they're able to solicit. So there are a lot of different fundamental things that are important, but it's absolutely something that people can accomplish as long as they commit themselves to the process.
Great. And Reverend Williams, I just thought about this because you mentioned something so crucial earlier in regards to the patient. Listen to the patient. The patient is the advocate. The patient is the expert. You said earlier, for example, if your parent had sickle cell trait, let's say your mom has it, and then your father has it, and then the child ends up with sickle cell. So we already discussed that sickle cell trait, sometimes you don't get all of the things you would. So we, as sickle cell trait people, don't understand your struggle. So you have a parent, and they have a child with sickle cell. What advice would you give them? Because, their child is going through something way different than they've ever known. Listening to those, mommy, I'm not feeling good, I'm hurting. Don't brush it off and say you'll be all right. What would you advice would you give them?
Yeah, thanks. That's a good question.
I know.
Since I was the one chosen one to have
right?
it, I can tell you that. I mean, you have to just read and research, and you gotta become evolved. I can tell you a story from my mom. Every parent, has this. Probably I do. If I could switch anything out of my child that was not, efficient to properly live, I would do it, right? And so I think when parents are have this opportunity, not afford it, but if this happens to them and their baby, they've got to speak existence. They've got to keep them. I'm more religious a little bit here. You got to keep prayed up, because I tell you, prayer helped me in my darkest moments. Encouraging from other warriors. I have a 78-year-old friend, Dr. Braxton, who's still living with sickle cell. I mean, there's so many stories untold, and so many that we can glean from as mentees and mentors. Is that we don't have any mentorship with sickle cell. Very rare. Men have issues that women do not. One is pietism, which is very common in with the disease. I've suffered with it, and so it's it can be a toll on mentally. But I would say read, research, go to the specialties, go to your local chapters and read. That's the best thing you can do, really, to make sure that you're informed with that conversation.
I was going to do a quick round the room, final words or any piece of advice, but I think you did close it out really well. Commissioner Warren, did you have a quick thing that you want to just 30 seconds that you can say?
I just like to say that this work is important. And if you are interested in starting some community activism, some community advocacy, please make sure that you do. And it is important that we do partner, that we work together, because it is something that is going to require all of our efforts to ensure that we can continue to move forward, because it took a lot of work of a very small group of people that worked hard to make sure that sickle cell was recognized as an inherited disorder in our country, and that we focused attention on it. And that group was the Black Panther Party. And I think that it will still take us working together and recognizing universally that it takes all of us to make sure that we move forward as a community.
Thank you. And Dr. DeBond, since you do it so well and so quickly, any last minute 30-second final words? And also, if you have any room for encouragement for our pregnant women that may be facing this sickle cell disease.
So let me start with the patient first, the mother who has a child in her womb with sickle cell disease. There's hope. Children born with sickle cell disease in 2022 and beyond, we expect them to live a normal childhood, to go through all the rites of passages that you expect every child and adolescent and young adult to go through. There are new drugs that are now approved by the FDA, and cure in 2032 or 2042 will be far better than cure in 2022. Otherwise, for the general population out there, keep the faith, keep the struggle, and remember, we do need corporate support beyond our faith to embrace the struggle to improve the lives of individuals with this disease.
Thank you. Thank you so much. Thank you all for a great show. We have some final words coming up from Justine Hampton, but please keep a lookout and listen out. We have more shows coming up this year. And I want to thank everyone who joined us. Thank our wonderful audience for all your wonderful questions. And let's keep these conversations going and engaged in our communities and our global communities as well, too. I know we have someone globally, so that's great. So thank you very much. And we're going to hear from Justine Hampton.
Thank you, Kitty. Thank you, panelists. Special thanks to Commissioner Warren, Dr. DeBond, Reverend Williams, and thank you to all the attendees for sharing your Saturday with us. What an amazing webinar. Please know your support allows both the Sickle Cell Foundation of Palm Beach County and the Treasure Coast, as well as Global Health and Community Service in their efforts to educate and inform the community on sickle cell disease and trait. At your opportunity, please visit Sickle Cell Foundation's website at www.sicklecellppbc.org and Global Health's website at www.ghacsi.org. To see the video that you saw clips of earlier today, Sickle Cell Disease and Gene Therapy, Patient and Physician Perspective in its entirety, please visit Global Health's website again at www.ghacsi.org. And please know that the efforts that the community is making to assist the warriors with this disease and to hopefully find a cure for everyone suffering from the disease, it relies on all of us. We all have an important part to play. So again, thank you for attending today's webinar and have a great rest of the weekend.
You